Hi, it's Leah Brick here with Conversations from the Couch with Dr. Elizabeth York. So glad to have you with us today, Dr. York. And you're going to be presenting for us at our virtual conference. Your title of your presentation, as I've got it here, Sexual Health After Traumatic Brain Injury, and presenting that on Thursday, October 15th at 10:30 in the morning Central. So make sure everybody's got their time set to Central Time, including me, since I'm Eastern. Welcome to our little chat today. So glad to have you with us.
Thank you so much. Thank you so much. I'm really looking forward to the conference.
Well, tell me about your presentation and what was the inspiration behind it?
I have been working with people with traumatic brain injuries for more than 10 years, and it's a tremendously complex, challenging process, the recovery from a traumatic brain injury, and it is very, very common. A couple of million people a year are affected by traumatic brain injury, and it's everything from motorcycle crashes or motor vehicle crashes, falls, sports injuries, domestic violence, assaults, and I'm finding it very important even now because our social atmosphere is so volatile. So it's really, really important. But one of the things that happens with traumatic brain injury is that the person who has the injury, they'll go to their doctor, the doctor may suggest a therapist, and they will work on things like the neurological issues and the physical issues. And the therapist or neuropsychologist will work on them with their cognitive issues, cognition, memory. A lot of times they'll work on things like focus and attention and stuff like that. And the thing that's very unfortunate, though, is most of my clients, they do very well with working with doctors and psychotherapists and behavioral health and people like that. But one of the things that they find that they tend to bring to me is the fact that they're having issues with their relationships. And this is extremely difficult because a person with a traumatic brain injury really, really depends upon whoever has been thrust into the caregiver role. Sometimes that will affect a marriage, it'll affect the dynamic of the marriage, it'll affect things like the person who was once the provider for the family is now the person who needs help. And the other person is now suddenly thrust into this position of being provider and support and, taking them to doctors and being supportive and trying to deal with their emotionality and their PTSD and the other psychological issues that occur. One of the things that happens, though, is the issues of sexual health, both physically and psychologically, and intimacy tend to get pushed to the side. They tend to, people don't see those as important as dealing with the medical issues or the physical issues or the psychological issues. And it's unfortunate, I think, because when the person with the TBI can find that level of joy and comfort and pleasure, that enhances their ability to recover in all the other aspects of their life.
Sure.
Okay, it really, really increases the energy level and enhances everything else. So I think it's critically important. That's one of the reasons why I wanted to bring this to the SASH conference. I've given quite a few workshops on traumatic brain injury, how to be a caregiver, how to work with your therapist, that sort of thing. But I've never been able to give one on sexual health, and I think it's so critical.
Mm-hmm. Yeah, it's really interesting that you say that, because that's one of the things that is important to us, is to know, why is your topic, why is the topic for each presenter important to sexual health? And I mean, it makes so much sense, right? They're dealing with all of these biological issues, these psychological issues, but yet the providers are not looking at sexual health as a part of this person's development or redevelopment, if you will. And it's crucial because sexual health is so much a part of who we are. It's our connection, it's our intimacy. It
Mm-hmm.
has everything to
Absolutely.
do with who
Mm-hmm.
we are as an individual.
Yes, and
So,
that's, yeah, and I have to agree with that. It's so basic and so primal, so primitive. It is when you look at a person's needs, okay, their hierarchy of needs, sexual health and intimacy and bonding and belonging are so critical that they are even more important than food and water and shelter, okay, much more critical than that. And it isn't just procreation, it's bonding, it's intimacy, it's belonging. That is the most crucial thing uh, about being human, okay? Um, one of the reasons why I'm finding that this subject is tend to kind of push to the side is because, as you know, in our society, it's a difficult thing to talk about. A lot of people have a difficult time talking about it. And I find that with men, especially, our society has, they've been socialized into, they have to be tough, they have to be strong, they have to be capable. And traumatic brain injury turns all of that upside down. Suddenly um, they don't know who they are. They've lost their identity. They've lost their relationship. They've lost their dynamic and how they interact with individuals. And some of the things that happen along with that are embarrassment, guilt, shame, blaming, um, remorse. All of those emotions will come into play. And so they, a lot of times, will not talk about it. I'm usually pretty good at getting people to talk about it because I help them understand that just because our society has told them they have to be a certain way doesn't mean that that's necessarily so.
right.
That I can create a safe space and they can discuss that, especially in couples. With couples, the partner a lot of times will experience confusion because they don't understand why this person is different than who they used to be. Why is their sex life, why do they not have the frequency? Why do they not have the intensity and the energy that they used to have? And there's a lot of reasons for that. Some are physical, some are neurological, some are psychological. So a lot of times I will work with couples to help the partner understand what the person with the TBI is going through and help the person with the TBI learn how to articulate their needs, how to ask, how to help their partner understand that what they need, how to ask for it so that their partner knows how to give it.
Mm-hmm.
And that usually really helps a lot.
I would bet that it does. I think what is really valuable about your topic for our conference is we're so used to talking about sexual health and problematic sexual behavior at the SASH conference, but we're not used to talking about TBI. And so, what I can foresee with your topic is that you're going to be educating us in both realms. You're
Mm-hmm.
going to be helping us to understand what's different about the needs of a person with a traumatic brain injury that they need to have different for their sexual health.
Mm-hmm. Mm-hmm.
And then what why that sexual health needs to be a part of that conversation.
Mm-hmm.
So not only is it how is someone with a traumatic brain injury different? How are they different than a client who has a sex addiction or problematic sexual behavior? How are their sexual health needs different?
Mm-hmm.
But
Mm-hmm.
why are we bringing sexual health into this as well? What do you hope people will take away from your presentation?
Oh gosh. I have the way I have my presentation set up. What I'm going to be doing is first I'm going to explain why this topic is so important. It is so prevalent. Um, Thousands and thousands of people have anywhere from mild concussions to severe traumatic brain injury, and it affects how they live their life and how they get back into um, finding a new normal. They're no longer able to be who they were before. A lot of times they will be grieving. There's so much that they don't understand, that therapists do not understand. One of the things that I would like to see happening is for when a couple or an individual comes to a therapist with anxiety, PTSD, or depression, have them ask a few questions about their the physicality of their life. Have you been in a car accident? Have you did you suffer an assault? Is your relationship fraught with violence? Is your did you play sports in high school? Did you play sports in college? Multiple impact injuries will result in a lot of times will result in anxiety, depression, and PTSD.
Wow.
The irony about that is that when the therapist comes in, they will treat the anxiety without understanding where that comes from. A lot of times with traumatic brain injury, those three conditions are neurological. And a person can go along, they'll do what they need to do. They'll have a lot of coping mechanisms in place. They'll do things like they know that their balance is off, so they will make sure that they hold on to things when they walk down the stairs and things like that. So they'll have all these coping mechanisms in place. But then at some point, the anxiety will escalate. I'm finding this a lot with COVID. When people are in lockdown and they're in isolation and they're afraid of catching the virus, that their anxiety all of a sudden will escalate to a point where it can result in agoraphobia, literally being unable to leave their home. So when they go to the therapist will say, well, this is because of COVID. This is because you're afraid. And it may not necessarily be. It may be that the neurological damage to the brain has caused the anxiety to kick up into something that they can't even deal with. It's not uncommon for traumatic brain injury to result in obsessive disorder. It's not unusual for it to result in hypersexuality. And these are all, it's not unusual for it to result in PTSD. And there's a lot of different things that happen, but it's not necessarily because the person is experiencing psychological issues. They're experiencing trauma, they're experiencing traumatic brain injury, which has neurological damage. So their brain is firing in a way that shouldn't be. If they had not had the injury, their anxiety would not have been so catastrophic.
Well, this is your first year presenting with us. We're so glad to have you.
I'm excited.
What is it about this year's conference that has you turning on your heels and just excited to be a part of our process?
I have attended a couple of the SASH conferences before, and the subject matter is really fascinating. When I work with couples and I work with individuals, a lot of times if I can get them to talk about their sexual health, if I can get them to a comfort level, then I can get some of the other anxieties and some of the other issues to settle down somewhat in their sensory nervous system. And then we can start working on the trauma. We can start working on the neurological issues. So it's kind of it's like, I like to say it's like peeling an onion. So, the first layer being the anxiety, you deal with that, and then you move on to the next thing. And then you deal with that and you move on to the next thing. And that's the complexity of the issues. I have often felt that when working with individuals, that I essentially wished that there was a venue where I could teach people about traumatic brain injury and how it affects the person on their sexual health and their intimacy. And quite a lot of my clients will go, wow, this is important. And you've really taught me a lot. You should teach my therapist. You should teach this person. You should teach that person. And I always go, well, I try to as best I can. So whenever I find a venue where I can share this information, I jump right on board.
Well, we're really glad to have you this year. You have added to our lineup of very diverse topics this year, and we're extremely grateful for that. As much as we would like to be in person and we're not able to this year, are there things about being virtual that you find benefit from, that you've actually been able to take away, walk away from our new virtual environment and say, gosh, this is one benefit that I wouldn't have gotten had we been in person?
hmm Actually, that was a tough question for me. You know, when you said the questions, I didn't really think about that because, as I said, I've done a lot of um, live conferences, and I really connect well with people. So a lot of times people will come up and they'll talk to me, and we'll have nice conversations. And I will share some things with them that they didn't know, and they usually walk away. My greatest joy is when they walk away going, "Huh, I didn't know that. Wow." I think that's a really good sign. So, and I am thinking about how will what benefit does this have if I don't have that aspect of it? One of the benefits is that we'll be able to reach so many more people. That I think is really tremendous. A lot of the conferences that I've done, it's always a shame that people want to come but they can't. You know, the physical logistics, or they just can't afford it, or there's a lot of reasons why they can't. So this way, I think is fabulous. We'll be able to reach so many more people.
Mm-hmm.
The not having people in front of me, sometimes I have to be really careful not to get off track and not to digress. So
We
I'll
all
have,
have that issue.
yeah, it's kind of a big thing for me. I'll have people in front and I'll be talking and I'll see somebody making that face, that 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 tell me more face, that explain to me face. And sometimes I will connect with them and they'll ask a question. And I've had workshops where all of a sudden I'm not able to finish the presentation because everybody's raising their hand and they're asking questions. The advantage of this is that I'll be able to get through all of the material without those interruptions. And I'll miss the interruptions, but it might be a good thing, I think, maybe.
Right.
So yeah, I think the more I think about it, the more I think this is going to be really tremendous. This is really going to help a lot of people.
Well, I do believe we'll still get lots of questions. They'll just be in a different format, and you won't be able to see those really pondering faces of, I wish you could tell me more about that.
I love that face though. That face and the, wow, that face.
Yes.
When people say
Yeah.
that.
When you know that something you're saying is really hit home,
Mm-hmm.
and
Yeah.
they're really learning something new.
Yeah, you can tell when it makes a difference.
Mm-hmm. Well, here we are in this virtual world, and we've been here for quite a while now. What are you doing to find balance in your own life and to bring some peace to your being after we've been online for so long? You know, some folks I'm talking to have been online 4 or 5, some 8 hours during the day. What are you doing for yourself to bring some balance to your life?
I do a couple of things, and basically it has to do with disconnecting from the technology completely. I'm an artist and I am a costume designer, and the costumes that I design are very elaborate, and they usually include armor and weapons and cosplay costumes. So that's what I do, is I step away from the technology and the cerebral, because when I start thinking about this subject, um, it's something that I really enjoy thinking about. Okay, and it is very cerebral and it can be exhausting. But when I step away into my studio and I either paint or I draw or I start designing a costume, I put on my headphones, I listen to music, and the entire world disappears. So I step away from technology into fantasy, sort of.
It's a total different kind of direction and focus when
Mm-hmm.
you're involved in creation. It's a different way to lose yourself
Mm-hmm.
from the virtual world. So I am a crafter and sewer and painter, and so there is a lot of that. It is cerebral in part because you're very focused, but it's a different kind of focus.
Mm-hmm. Yeah, it's a different part of your brain. And that's one of the things that I tell my clients a lot of times, is to step away from being focused on their brain injury. You know, the doctor appointments and the insurance and the, the therapist and all the stuff that they have to do. Just step away from it and do something creative. When I had my motorcycle crash, that was really important because I broke a lot of bones and I got the traumatic brain injury. And I'm, for the most part, recovered now. So I'm able to do this work. I found that because I couldn't take painkillers, that I could paint. I could do watercolors for 12 hours at a stretch. And that led me to understand why art therapy is so important. It's because it gives you a voice that you don't normally have. And it releases endorphins into your brain, and it allows you to use a different portion of your brain, allowing the injured part to relax and recover and rebuild. So that's, yeah, it really is. It's fascinating the way the brain works.
Well, I'm so glad that you're coming to join us this year. And as a reminder, your session is Sexual Health After Traumatic Brain Injury. It's on Thursday, October 15th at 10:30 Central Time. Dr. York, thank you so much for being with us today for Conversations for the Couch. And we look forward to seeing you in a very short time in our virtual conference.
Yeah, it's going to be great. I'm excited. I can't wait for it to happen.
All right.
But thank you so much.
Thanks. Bye-bye.
Bye-bye.